everyone, and welcome back to the IPC in Action podcast. I'm back after a little hiatus. I'm Fran, and one of the infection control nurses. And today we thought we would give Jen a break, so I brought two very special guests with me, two of my lovely colleagues. So introduce yourself, guys.
Hi, my name's Sophie. I work with Fran, one of the infection prevention control nurses.
And I'm Maja. I've been in IPC for over a year now. You probably see me out and about, mostly on medical wards and the DNS division.
So we are going to cover a topic today that, everyone's very familiar with it, but we thought it'd be a really good idea just to go back over it again and just introduce some new kind of statistics, ideas, and just kind of cover the basics and the real infection control, what we would say brilliant basics, the real fundamentals of infection control. So we're going to be covering today bare below the elbows, or BBE, if you will. So we'll just start off by just covering what the bare below the elbow requirements are, and this is standardised across the NHS in England, across healthcare in England. So again, as I'm sure as many of you will be aware, that everyone needs to be bare below the elbow, and that includes not having any bracelets, rings, so stone rings. You can have one plain wedding band if required, and you should not have any gel nails, acrylic nails, any nail extensions, nail varnish. This is all part of not only the NHS uniform requirements, but our trust uniform requirements as well. There are some exceptions in terms of if you require long sleeves or three-quarter length sleeves for cultural, religious or spiritual reasons, then they are permissible if not involved in direct patient care, but they must be rolled up for direct patient care or hand washing. Alternatively, you can use disposable oversleeves, but they must be disposed of in the same way as PPE. And any sleeves that you are wearing shouldn't be dangling, they should be tight to the skin. So there's loads of information, loads of infographics on that on the British Islamic Medical Association website, or BEMA. So there's some really good information on there if required, and that is also going to be part of our uniform policy. So that's just kind of covering the basics. We're just going to have a discussion about it, basically. Just like kind of things that we've seen, like how it can affect us day to day. So,
I've definitely seen a few watches floating around recently,
yes.
wrist watches.
Oh, watches, yes.
Yeah.
Yeah.
So I guess the thing with watches is, well, obviously you're not bare below the elbows with that, but how do you wash your wrist when you've got a watch on?
Yeah.
Or even higher up, your forearms.
100%. And I think when we were having a look for some research on it, we found a couple of pieces of research, and I don't know if you guys have seen this one. So this is a research article from 2023, and they did a study on, 7,544 healthcare professionals, and this included doctors, nurses, also non-registered practitioners, so porters, domestic staff, catering staff, pharmacy staff, AHPs, literally everyone. And they found, so they split the group into two. Half were bare below the elbows and half weren't. And they found that the healthcare workers from the bare below the elbows group statistically were more likely to disinfect their hands correctly in terms of the steps of hand washing. So that was 73.1% of that group would disinfect their hands correctly, compared to just 55.5% of the non-BBE group.
That's quite a difference as well, isn't it?
Yeah, pretty massive difference, because, I don't know, I suppose if you think about it, if you're wearing a watch, you can't wash your wrist correctly. And even if you're taking it off and taking it back on again, we've seen some things, haven't we? When we did swabs from all of our stuff, we can see.
Oh, that's right. You guys swabbed under rings, under watches.
Yeah.
Yes, and I think it's really important to point out the rings and the nails.
Yeah.
Because, we may not notice what actually gets harboured underneath. We don't see it with our bare eyes, but trust me, as we said, if we do swab those areas, I think we would all be surprised, you know, what actually lives under there.
Yeah.
And, you know, we all like to have our nails done when we're
Yeah.
off or on our
with the summer
birthdays.
holidays.
Love it.
Exactly, we go into a wedding.
Yeah.
But, you know, just try and envisage and imagine what actually gets under there, and would you want to carry it home, really?
Yeah, exactly.
I mean, even if you're wearing false nails as well, like trying to wear gloves.
Oh,
It's really
they
challenging,
pierce
right?
Yeah.
through, don't
Yeah,
they?
Exactly. I know. We almost like need to do like an experiment with it, like seeing the difficulties of it.
So top tip, I guess, is if you are getting your nails done outside of work, book your appointment to have them removed
Yeah,
or sorted
exactly.
before you come back to work.
Set up a reminder on your phone.
Yeah. I think yours was a really good point as well. Like literally just taking the time to envisage what could be there. And you know, whilst even if you don't have like the nails on or nails painted, acrylics, whatever, yes, nails can still be dirty, but they're obviously much easier disinfected than if you were to have these nails with the little edges that can peel, lift up.
Chips.
Yes, exactly.
Yeah.
So, yeah.
And also the rings. I mean, I got engaged maybe 2-3 years ago, and I remember the excitement and wanting to show off my beautiful diamond ring, and you know, I just wanted to bring it to work and show all my lovely colleagues, but then I thought, actually, do you want my diamonds to be dirty?
Yeah, exactly. How many people mean?
So yeah, just think of, you know, again, try and imagine what would happen to that lovely ring of yours. Do you really want to get it dirty?
And then you're taking it home as well.
Exactly.
And things like this.
Yes.
Absolutely. So yeah, it's just a lot of things to consider in that respect. And the same goes for, like, even when you were saying with watches, in terms of, like, we see a lot of people with, I don't know, like little string bracelets, hairbands, it all applies to the same thing. So it's literally thinking of you're entirely bare below your elbows apart from a plain wedding band or the requirements for cultural, religious or spiritual reasons, if needed. So I think it's also just taking a moment to take like real pride in our uniform as well. And we learned something, well, not learned something, this isn't new in any way, shape or form, but bare below the elbows in healthcare was introduced in September 2007, and this was across NHS trusts. So this also came at the same time as a ban on white coats for doctors. So bare below the elbows and no white coats for doctors. So it's part of a number of interventions that really dramatically reduced the burden of hospital-acquired infections, because obviously we see a lot of them, and whilst it's hard to know always where exactly they've come from, it's a measure that we need to have in place to take away that burden.
So important for patient safety.
Yeah, exactly. And if you think about it now, what if you saw maybe one of the doctors walking through the corridor in a white coat, you'd be like, oh,
That's a bit strange.
yeah, exactly.
What's going on there?
Yeah, exactly. So I think we need to put our focus back onto the fact that if we saw that in a corridor, a white coat on one of the doctors, we should be having the same attitude towards bare below the elbows.
Yeah.
Because they came in at exactly the same time, and actually in the relatively recent past as well. So the fact that these were introduced so recently, perhaps, just, you know, we should still be considering this as being so important, because it really is.
Yeah. And challenging each other with kindness, isn't it? Yeah.
Exactly.
Correct. Kindness and respect.
Yeah.
You know, we can all try and challenge each other and in a way help each other realise, you know, it's not done in a malicious way. It's just to make sure that we're all following the same sort of guidance, and you know, it's easy to forget at times. So it's nice to remind each other in a respectful way.
Yeah, absolutely. I think one of the ways, I mean, I think there's always going to be a bit of skepticism about, you know, the maybe the amount of bacteria you might find around a ring, around a watch, nails, etc. But one of the really good ways that we can help as a team to kind of show this impact and show how it can spread, we have we have some tools, including our lovely glow boxes, which I'm sure people have heard of and have used before, which can really show, if we were to ask you to put on, say, all of your rings and everything you're wearing at home, watches, and then wash your hands and look under the glow box at how much things can stick around these places. Like, I think, actually, I mean, we're shocked when we do it. So I think it'd be really interesting if you'd like to see that. Please let us know, and we can definitely sort out bringing them round for you.
Washing your hands is challenging at the best of times, even without, lots of rings and jewellery on and things like this. But I guess, like you were saying, Fran, so important for patient safety and healthcare associated infections.
Absolutely. And I think another thing, because everyone is so busy, another thing that we're not always the best at doing is putting ourselves into other people's shoes and thinking about how, if this was our family member in hospital under our care, we, as we've said, I'm sure, a million times before, and we all know this, and we know that we know this, we would want the best for them. So if the best way that we can carry out our jobs is to be able to effectively carry out hand hygiene, and that involves being bare below the elbows. So I think that's a really important point to consider.
Yeah.
But hopefully, I mean, that's been a very kind of quick discussion on bare below the elbows, and hopefully its importance, and hopefully it can be recognised, and just realising, like, actually, like we were saying about the white coats, and that actually there's a comparison there, because they were brought in at exactly the same time, and I know I was shocked when I kind of found that out, because I didn't actually know about the white coats.
No, I didn't either. That's a new one for
me. So I mean, even us as infection prevention specialists, as it were, I mean, it's a lot for us to kind of take away as well. So hopefully helpful discussion for anyone listening. But yeah, do you guys have anything you want to round off with? Any messages?
I mean, there's loads of places you can put your watch as well. You can pin it to your uniform.
Yes.
You can, pin it inside your pocket.
Yeah.
You can put it on your which is what I do. I put it on my lanyard and tuck it into my pocket.
Yeah.
So just kind of thinking outside the box, I guess, where you're going to put your bits.
Well, yeah, that's not. Sorry, I forgot to mention. That's another thing, is that if anyone has any ideas, anything that you think would help, because we know that people like to have their smartwatches, count their steps.
Right?
Understand.
Yeah.
Very healthy.
And calories.
Exactly. And I've tried mine in my Apple Watch in my pocket, and it does work. Yes, sometimes it may not be as effective, but it does work. If anyone has any ideas as to how to combat this, whether we are able to get some of the fob straps that you can put your Apple Watches on, Google Watches, whatever they're called, all of the above, please let us know. Anything that you're concerned about, we're happy to hear it. We're happy to take any opinions, anything at all. And if you want any teaching, anything like that, us to bring the glow boxes, we've got some special kind of UV powder, that kind of thing. We're more than happy to help. Yeah, thank you guys for coming and joining me on my
thank
first
you for
podcast
having
back
us.
Loved it, thank
March,
you.
I think. I've not been on here since March.
Well, you look very refreshed after your holiday, so there you go.
But yeah, no, thank you very much. And as always, our contact details are extension 6122 for Gloucester and extension 3129 for Cheltenham. And we will be back in August with another couple of interesting topics. And I might bring Sophie back with me.
Oh, yeah.
So we will see you in August. Bye, everyone.
Bye-bye.